Hi, my name is Jessica Strickland, and today I'm going to be showing you a presentation on Kangaroo Care. Kangaroo Care was developed in 1978 because there was a noted increased mortality rate in premature infants in Bogota, Colombia. Dr. Edgar Ray Sanabria was the gentleman who invented this method due to the fact that he wanted to alleviate caregiver shortages and overcrowded incubator space. Kangaroo Care is a method of performing direct skin-to-skin contact between mother and premature infant. Kangaroo Care is when you take the premature infant and place it in between the mother's breasts on her bare chest with the ear facing downwards to the heart, as stated by the American Pregnancy Association in 2007. A study was then conducted and a significant drop in the mortality rate of premature infants was noted due to the benefits of Kangaroo Care. Research has shown that close skin-to-skin contact between infants and parents has been proven beneficial because it supports the stabilization of breathing, thermoregulation in premature infants, and it also increases the success with breastfeeding. As you can see in Figure 1 here, I have compiled data from the Journal of Neonatology Nursing 2007. Respiratory rate, it collects data from before Kangaroo Care, during Kangaroo Care, and after Kangaroo Care. This data is based upon 3 different groups, Group 1, Group 2, and both groups combined. Before Kangaroo Care, you can see that the rate at which a premature infant breathes is variable, 45, 43, and 42 breaths per minute. During the process of Kangaroo Care, you are able to clearly see that the rate at which the premature infant's breathing levels out and decreases to a rate of about 40 breaths per minute. After Kangaroo Care, the rates are still variable, 44, 43, and 43, but as you can see compared to before, there's not as great of a difference in variable. You want the premature infants to breathe at a slower rate due to the fact that when they're breathing slower, it decreases their caloric expenditure, which also helps them to gain weight. Figure number 2, which is provided here, data was also compiled from the Journal of Neonatal Nursing 2007. It is also clearly visible here that there are benefits during Kangaroo Care. Information here was also obtained before, during, and after, as in the previous figure I have showed you. In this figure, it allows you to clearly see that during Kangaroo Care, oxygen saturation levels have increased by at least 1% in each group, Group 1, Group 2, and both groups combined. Also, some important respiratory facts are that breathing rate and depth becomes more even during Kangaroo Care. Apneic periods decrease dramatically and often disappear altogether. A randomized controlled trial was conducted to investigate the cardiorespiratory effects of Kangaroo Care on a healthy preterm infant. It was noted that apnea and periodic breathing were absent during Kangaroo Care, as noted in the Journal of Transfusion Medicine 2008. As stated before, now I'm going to touch on my next point, which is benefits of Kangaroo Care with thermoregulation in the premature infants. Premature infants and neonates have difficulty with thermoregulation due to their decrease of subcutaneous fat and their increased body surface area. This makes premature infants very susceptible to hypo or hyperthermia. When an infant becomes hypothermic, it increases their oxygen consumption. This was information obtained from the British Journal of Hospital Nursing. Maternal breast temperature can rise quickly and then regulate to stabilize the premature infant's temperature. Mothers naturally modulate their temperatures with the skin-to-skin contact to keep their infants at optimal temperature. When premature infants are at their optimal temperature, it decreases caloric expenditure, increases oxygen saturation, and improves quality of sleep time in the infant. This was stated in Midwifery Today in 1997. As I just stated to you, when infants are at their optimal temperature, oxygen saturation is improved, caloric expenditure decreases, and infants get optimal sleep time, which in turn improves their weight gain and dramatically accelerates their growth. The last point that I am going to touch on today is that Kangaroo Care is directly associated with an increased success rate with breastfeeding and milk volume. The close skin-to-skin contact associated with Kangaroo Care positively results in the increase in breast milk volume and facilitates milk letdown, improving the success rate at which infants feed. During Kangaroo Care, infants are at optimal placement to spontaneously wake up and self-regulate their feeding. Breast milk is known to have positive effects on an infant's immunity, so with more milk being produced and the increased success rate associated with Kangaroo Care, in turn, this is beneficial to building a stronger immune system in the premature infant. This information I obtained from an article in Transfusion Medicine in 2008. In conclusion, research has shown that close skin-to-skin contact between infants and parents is beneficial because it supports the stabilization of breathing, regulates temperature, and improves success with breastfeeding. These three things mentioned above are crucial to the premature infant, or any infant for that matter, to continue to thrive and grow. In conclusion, no harmful or negative effects have been found associated with the use of the Kangaroo Care method, and therefore practicing this method can only be beneficial for both infant and parent.
Does Kangaroo Care reduce the amount of time premature infants spend in the NICU or the hospital?
Randomized controlled trials were performed, and it was noted that Kangaroo Care infants are discharged from the hospital earlier, and they also spend less time in the hospital with follow-up, as stated by Transfusion Medicine 2008.
How often are parents supposed to be performing Kangaroo Care during a 24-hour period?
Kangaroo Care can be used around the clock or for sessions of no less than 1 hour in duration each time. The length of skin-to-skin contact gradually increases to become as continuous as possible, day and night, only interrupted for changing diapers, especially when no other means of thermal regulation are available, as stated by the World Health Organization Department of Reproductive Health and Research, 2003.
After discharge, should parents continue Kangaroo Care with the infant?
Kangaroo Care continues to be used until a baby reaches term, which is roughly 40 weeks of gestation, or when they reach a weight of 2,500 grams. This was stated by the World Health Organization Department of Reproductive Health and Research, 2003 also.